Hello, this is case number 13 of the case-based discussion series. What are our histories? 28-year-old male, generalized edema, lab reports, blood urea 40, serum creatinine 1.2, serum cholesterol 350, serum calcium 7.1, serum albumin 1.5, urinary protein 4 plus, and RBC class negative. What is our diagnosis and how do we establish it? First of all, we'd like to look at this generalized edema. This is the first clue that this could be some kidney disorder. Because edema, mostly we will think of the kidney problems. Like as the kidney is not filtering the fluid, so the fluid is remaining inside. Now we come to these parameters one by one. So blood urea, we have 40. What is the normal value? 15 to 45 units per day. Okay, so urea is normal. Serum creatinine, we have 1.2. What is the normal value? 0.7 to 1.4 mg per day, or little less in females, 0.6 to 1.2. So what is our value? Normal. So apparently prima facie this does not look like a renal failure case, but this is a clue that there is something to do with the kidney. Okay, so it's a kidney case, but it's not a renal failure case. Then what? Let's move ahead. Serum cholesterol 350. This is a very important clue. What should be the usual serum cholesterol level? It should be less than 200 milligram per deciliter. So this is the first important clue for our diagnosis. Serum cholesterol 350. This is the first important clue. So what is this condition called? This is called hypercholesterolemia. Hypercholesterolemia. Next, serum calcium is 7.1 mg per day. What is the normal range of serum calcium? 9 to 11 mg per day. So you can see there is reduced calcium in the blood, that is called hypocalcemia. This is also a supporting finding. We'll just keep it here for now. Next, serum albumin. Serum albumin is 1.5 gram per deciliter. This is also very important for establishing our diagnosis. So what is the normal range of serum albumin? 3.5 to 5 gram per deciliter. So we have 1.5. Means the albumin is reduced. So what is this condition called? Hypoalbuminemia. Hypoalbuminemia. Next, urinary protein is very much reduced, 4 plus. So this is also very important for establishing our diagnosis. So normally do we find proteins in the urine? No. No, we don't find proteins in the urine. But here 4 plus. So what is this condition called? Proteins in the urine is called proteinuria. Proteinuria. And finally RBC cast in the urine is negative. So those who have seen the previous video, the previous case, there the RBC cast were positive. So there we had a different diagnosis. Here it's negative. So finally we have our 3 points which I have marked in yellow. These will lead us to our diagnosis together with this. So hypercholesterolemia together with hypoalbuminemia together with hyperproteinuria. This triad together with the history of generalized edema, this actually points to one very well-known disorder. Yes, it is a kidney-related disorder, but it is not renal failure. The disorder is nephrotic syndrome. So when we have this triad of hypercholesterolemia, hypoalbuminemia and hyperproteinuria, together with this type of a history of generalized edema, then we will usually think of nephrotic syndrome. Nephrotic syndrome is usually seen in the young aged patients, to be more specific, young boys. So it's a frequent pediatric case. Young boys we see, but in this case, this male is 28 years old, but even here it is nephrotic syndrome. So nephrotic syndrome is usually seen in young boys, but can happen in the older people also, in the adults also. So one final point before we end this part. What about this? Why is it? So I told it's not normal. So then what is the issue? So there is hypocalcemia. Why? Because in the blood, the calcium usually remains attached to the plasma proteins, mainly to the albumin. So as the albumin here is decreased, so the calcium level is also coming low because the albumin is decreased. This is called pseudo-hypocalcemia, this particular condition, why we are getting the low calcium levels in nephrotic syndrome. So that is our diagnosis. We have one more case coming up on nephrotic syndrome very soon. Stay tuned. Thank you.